Early on, a sonogram picked up some deformity.
He had Pierre-Robin sequence.
I started noticing the way his spine was curved around 5 months.
It progressed so quickly.
He was sitting, he was crawling, but he wasn't walking.
He had a congenital kyphoscoliosis.
This is a model of his spine, and that would be the turn in this plane. And then scoliosis is a coronal plane deformity, so that's the turn off to the side. And so he had both. When you have a severe curvature of the spine, it can limit the size of the bony canal through which the spinal cord passes.
The spinal cord is starting to be pinched so much that the nerve signals aren't making it from the brain to his legs.
When you see your kid losing the use of his legs, you gotta do something about it if there's something you can do.
If you don't do anything, he's just not gonna walk, and you're not gonna be able to fix that. And if you do the surgery, that may also happen. But there's also potential that we'll be able to free the pressure on the spinal cord to improve his function.
I was like, well, the decision's made. You know, we have to do this. It was extremely difficult because
It was really hard.
You know that you're risking your child's life.
When we have to take out, multiple levels of the spine, that's the most challenging type of surgery we do. You're disconnecting the spine. You can't just sort of slowly nudge it over like we do in typical scoliosis. You have to actually break it into 2 pieces.
And in order to straighten it as best we can, we need to put in screws and rods to hold the bones and control them.
Because of his size, your safety window for those screws is very small. So if they're too far to the inside, the screws can damage the spinal cord. If they're too far to the outside, it can damage the lungs, organs in the belly, even major blood vessels.
We sat down together and went through every bone that we were planning to put screws in and decided which of the guides we thought fit best and if we thought the screw trajectory was appropriate and safe, and spent a lot of time just looking over his 3D reconstructed images and his CT scan.
We actually have a grant from the Pediatric Orthopedic Society of North America, studying the impact of 3D models on surgical planning and safety.
That is such a huge level of comfort to think that this isn't the first time that they're even going to see it. They're actually going to take the time to trial and error to eliminate some of the risks involved.
I saw Dr. Hankinson and Dr. Garg walking out, and they were smiling, and I was like, okay.
Yeah.
And they were laughing together, and I'm like,
It must have gone well.
okay. So that was kind of like an instant relief.
After the 2 straight weeks, he started crawling. He was on the floor here in the living room and just like, look, Dad, and then got up on all 4s and started moving forward. I mean, and we melted. Within 2 weeks after that, he was taking steps.
He's still going to have challenges. His Pierre-Robin syndrome is still there, so there are going to be challenges from his small size. But now he moves around as well as other kids his age.